For people suffering from depression, there's another option besides medication for treatment. It's called Transcranial magnetic stimulation. It's a non-invasive treatment that uses targeted magnetic pulses to stimulate nerve cells in the brain that are believed to be underactive in people with depression. Carolee McGrath sat down with Dr. Piyush Johari from Holyoke Medical Center to learn more.
TMS stands for Transcranial magnetic stimulation. Transcranial means it is the magnetic field is applied to the skull, and the magnetic field goes through and stimulates that part of the brain that we are trying to focus on.
So how does it work? Like when somebody walks into your office, what's the procedure? How long does it take?
The idea is to stimulate a certain part of the brain on the left front part of the brain, because studies have shown that that part of the brain is connected to deeper parts in the brain that don't work so well when somebody has depression.
So is there like a headband? Like how is a patient set up in the office when they walk in?
Basically what happens is it's, the patient is awake, doesn't need sedation or any anesthesia or anything like that. The chair is a comfortable chair, like a dentist chair. You sit back like that, and the first session we do what's called mapping, because we are trying to focus on a part of the brain on the left frontal part, like I said, which is the size of like a ping pong ball, a little bit smaller. So we have to know where to focus the magnetic field. So we map the patient for the first session, and then we have the coordinates, and then we know where to focus it every time going forward.
Okay, so they sit there and how long does it typically take?
Typically, a treatment takes around 20 minutes.
Do you feel anything as the treatment is going on?
So think of it like, like you're knocking on wood, like that. So you feel like a tapping sensation on the head. Mm-hmm. Most people find it a little discomforting initially, but they adapt to it very quickly, and soon they don't even feel anything. They're okay with it. So
you have one session, and then there are follow-up sessions after?
Yes, the treatments that we do and are recommended nationwide, is 5 treatments a week. We do them Monday to Friday, and the treatment lasts for about 4 to 6 weeks. So it is a commitment of time on the part of the patient.
And what are the benefits for that? And who would be a candidate for this type of treatment?
Typically, the kinds of patients who are referred now are patients who have kind of not done so well with medications, one or more trials of medications. They have not responded to that, or psychotherapy has not been effective for them.
And when we talk about depression, it's such a complex problem. There are a lot of different factors that go into it. Can you explain, if you were to the layperson, what is depression as opposed to somebody being sad?
Yes. Yeah, that's a great question. It's often confusing in the mind of a layperson. When psychiatrists talk about depression, we mean clinical depression, and it's different than ordinary sadness. Ordinary sadness, or normal sadness, shall we say, is it's a normal human emotion. You have something disappointing in your life, you get upset, but then you move on. Depression is a little bit more sort of global than that, if I may say so, by which I mean people not only feel sad, that is the fundamental core symptom, but they get affected, their energy goes down, their interest in life goes down, they view themselves as less than others, they view the past and the future differently. It's very dark. So it's more global, and it affects, memory, attention, drive. So it affects different parts of the brain, and that's what we treat when we say depression.
So it's both chemical and an emotional condition.
Yeah, I mean, it is chemical. At the end of the day, all our human experience is converted into chemicals in the brain, but it's hard to separate that this is chemical and this is environmental, because we experience, what's happening in our lives, and our brain sort of responds to that.
What are some of the drawbacks of taking medication? Because I know that some people, as you said, don't respond to it, but doesn't it carry some risks as well?
Yes, I mean, medications can be very helpful. I mean, they have been the mainstay of treatment for a number of decades now, but there are limitations. People often don't like to take medications, or they don't feel good on medications, meaning side effects. And so they discontinue medications. Another common problem we have is compliance. You tell people to take medications every day, and they don't often do that. They forget, or they're ambivalent about it. So medications has their limitations.
And does TMS have any side effects that you have seen?
Yes, no treatment is perfect. The most common complaint we have is, like I mentioned, that people feel a little local discomfort, where the stimulus is. But in our experience, most of the people adapt to it. It's not terrible. You can have a headache, which often responds to, it just goes away by itself, or you can take Tylenol or simple over-the-counter medications. So those are the common sort of side effects,
Do you also
feel.
have psychotherapy as well, where somebody will go and just talk about their problems? Does that go hand in hand with the medication or with TMS?
It definitely, it can complement either of those treatments, and the best treatments for depression are usually a combination of, therapy, that's talk therapy with medication, the talk therapy with TMS. So they don't exclude each other.
For people who are discouraged, there's so many people that we know, who are really struggling with depression.
Yes.
For those who are discouraged and feel like, this is just never going to go away, what would you say to them?
Well, it is a complex problem, like I said, and but there is a lot of hope, and I think we have different tools in our toolboxes. There is talk therapy, and there's different kinds of talk therapy. Some styles of psychotherapy may or may not appeal to a certain person, but we have several schools of thought there. There is a large variety of medications. There's always new medications coming up. Then there is transcranial magnetic stimulation, which is sort of a new sort of area that has come up. So I think it's very exciting. And the way I look at it is, this is only the first phase in this new mode of treatment. There's more to come in terms of, can it be used for other conditions? Can we do it in a different way that doesn't make it 4 to 6 weeks, and so on? There is more research coming along, which I think we will refine our understanding of how this treatment helps people.
But certainly, if you are struggling, reach out for help, correct?
Oh, absolutely. I think it's very important to have an evaluation, a proper evaluation with a trained mental health professional. It can be a therapist, a psychiatrist, and even your primary care doctor. Actually, they treat the most number of depressed patients, the studies have shown. So asking for help and getting a proper evaluation is very helpful. And there are very good tools to do that. It's not that complicated, but people often hesitate to seek help, and that's unfortunate because depression has a dark side to it.